Okay, so this is some of the terms you need to know before you go into, getting to look at some of the parts. Now you looked at tissue, but now we're going to really look at the parts. So the number one thing I think we should talk about, and you'll see this again, is what is the anatomical position? The anatomical position, and this guy right here is basically in the anatomical position. It's not the best picture, but when we go to the bones, I'll show you a little bit better. This is his front view, which we're going to call the anterior. So if you notice his thumbs or her thumbs, it doesn't matter, are facing outward. So in the anatomical position, the palms are facing forward and the thumbs are pointing outward. And that's really going to be important later on. And the feet are straight downward, usually downward, or at least you could see the top of the foot, which is later is going to be called the dorsum. And the head is straight. So it really doesn't matter if we're looking at the front of him or back of him or her. This subject is still in the same position, and that's anatomical position. Once again, head forward, thumbs out, palms facing forward. So if we turn him around, that's all. Nothing's going to change. We're just looking at him from the back, and that's called posterior. So front view is called anterior, and the back view is called posterior. Now, a couple other things you want to notice: a midline. Like there's a midline in us, and sometimes we call it the long axis. So on the arms, if you look at the arrow where this arrow is pointing, the arrow is pointing closer to the midline or closer to the body, even if you lifted up the arms. So that directional term is called proximal. Like, for example, the shoulder is proximal to the elbow, and the elbow is distal to the shoulder. And that's really going to be important when you're looking at certain bones. Like when you look at the tibia, it kind of has a look like this, the front bone. Not exactly, of course, this is not the best drawing, but it's not going into the Whitney Museum. But you have to know that distally, the tibia has a medial malleolus. And then the top of the tibia is the proximal tibia. So you have to know the terms proximal and distal when you're looking at the bones. That's really important. And that's the kind of term I'll be using a lot. And you might have heard that when you did the joints. So that's really important. Superficial and deep, we don't really talk a lot about with bones, but we may talk about more superficial muscles. Like the trapezius muscle is superficial to the rhomboid muscle, which is in the back. And you'll see what that means. Like the deltoid muscle is your shoulder muscle, which is superficial to a deeper muscle like the supraspinatus, which you'll learn later. So superficial and deep is probably going to come into more effect when we do the muscles. So just take a look at some more. So anterior, posterior, proximal, distal are probably what we'll use a lot when we look at the different bones. Superior is top, makes sense. Superior is top, inferior is below. And sometimes we refer to superior as cranial. Now we're bipeds, right? We have, our head is straight forward, upward. Some other mammals, quadrupeds, it's a little bit different. So they call superior could also be called cranial, and inferior, again, is ours at the bottom, could be called caudal, and caudal means tail. So you got to remember we're mammals, right? And we're animals in that kingdom. So we kind of share some of these terms, but I'll probably most likely use the term superior and inferior for top and bottom. Superior top, we're towards the head. That's what they call cranial. And I'll use inferior more towards the bottom or below. Now here's another more of a comparative term or terms, anterior and posterior. Like I said, the front in the anatomical position or any position or any bone, you have to know anterior versus posterior, right? So I think it's good just to get the opposites, like anterior, posterior, superior, inferior, proximal, distal, cranial, caudal, all right? So again, we are bipeds, so we tend to call our belly side anterior. And ventral would be more in other mammals, right? Let me just mute that. If you can mute that mic, if you don't mind, thank you. I'll do it for you. So ventral is more the belly side of animals or quadrupeds or fish, or mammals, I should say, like dolphins. And dorsal would be the back, posterior, even if they are in a horizontal swimming position or a quadruped. So I'm more likely going to say anterior and posterior. Now, when you get to the brain, we might have to revisit these ventral and dorsal. So please keep those in mind. This is an important one too. Medial and lateral. Like, I'm not sure if you know exactly, you probably do. The breastbone is pretty much right in the center of our chests. So it's in the midline of the body. So the breastbone is called the sternum. So the sternum is medial to the shoulder, or the humerus is the arm bone, which you'll learn. So the sternum is medial to the humerus, and the humerus is lateral to the sternum. So the humerus is out here, the sternum's in here, even though this is the back, sorry. So this would be more the front. Again, anatomical position, thumbs out, palms facing forward, anterior view. Intermediate could be in the middle, and you could have a proximal distal and an intermediate, or a medial and lateral in the anatomical directional terms, okay? So let's do a little exercise. Like, you got to give me the opposite. Play with me, please, please. Emily, you're here, I see you. Avanel, Sin, please play along. So if I say anterior, what's the opposite?
Posterior.
Posterior.
Or whatever.
Yeah, good try, good try, good try. So anterior, posterior, that's probably the most important one. If I say distal, what's the opposite?
Proximal.
Proximal, right? Oh, Sam.
Am I supposed to raise my hand? Now I feel bad.
No, just put you just talk whenever you want, no problem. We're just practicing. Now, what if I say lateral? What's the opposite? Think
Can
the
you say
middle.
that medium?
Lateral, what would you say, Erica?
Lateral.
What's the opposite? Anybody?
Sagittal?
It's
Sagittal?
medial. But
Yeah.
it's not, sagittal is just a view or a plane. Like, we probably learned that in chapter 1, right? But the medial and lateral, because these are directional terms, not planes. Good point, though. Because again, we have to have these down before we move on to the bones. So what about, let's do it again. What about anterior? What's the opposite? Anterior,
Posterior.
proximal,
Distal.
lateral,
Medial.
dorsal,
Frontal?
ventral. Ventral, I
Ventral.
got you on that one, right? Cool. Superior,
Inferior.
excellent. Superficial,
Deep.
you got it. So those, just go through those. They're not the best pictures that I showed you, but when we go through the bones, you'll have to go through these opposites and these points and directional terms. Really important as you're going through. Cool, cool. Okay, so this is really one PowerPoint I have installed in both the labs for this week and next week. So you could use them both just to go through. And they're both axial and appendicular, but today we're going to key more on the axial. And the blued out parts here are basically the axial skeleton, and you can see it's along the long axis. Appendicular has to do with the appendages, which are the arms and the legs. So we'll do them next time. And believe me, they're both just as involved. There's a lot to do. The skull's pretty difficult as far as memorizing, but you have your checklist. So, and the MH Connect, so you can go through that and really get a good idea of what you need to look at. So this skeleton, I can't see his left hand may be pronated, so I don't know if it's in the anatomical position, but this side is anatomical because his thumb is facing out, or her thumb is facing outward, and that's really important for later, for next week especially. Facing forward, head is not turned, right? That's anatomical position. So everything that's blue on here is axial, and anything that's not blue, the other bones are going to be considered appendicular. And again, very important when you're looking at anatomy. I'm sure I've mentioned this before. The model, the photo, the patient owns the anatomy, not you. So when you're looking at these pictures, this is their right, even though it's your left. You understand? So this is truly anterior view. And always write down what this is. This is anterior view, right? And this is left. This is posterior view. Now, your right is there, right? Because they're turned backwards. So it's left and right. They're turned around. You're looking at posterior view. So you could see the skull, the ribs, the sternum, the sacrum and coccyx, the complete spinal column, all the way down to the sacrum and coccyx, the rib cage, sternum, cranial, facial bones, and mandible. They're all part of the axial skeleton. So very important that you know those bones and where they are. But I won't ask a lot of questions about axial versus appendicular, but once you get into it, it'll be very easy because you have enough to worry about what bones you're looking at. So these bone markings are basically, this is very difficult. There's bone markings, and again, we're going to go by our list, so you don't have to know every single bone marking ever designed by creation, but you should know a lot of them, and some of them are important to identify the bones. So bone markings are usually bumps and ridges and fossas, and you learn all these as we go. Foramen is a hole, grooves, spines, processes. They're all parts of the bones where maybe a nerve or blood vessel goes through, like a hole, or a muscle attaches. Remember, we talked about tendons and ligaments, right? And you talked about them in joints. A tendon attaches muscle to bone. So the bone has to have an attachment for that tendon to move, and that's about movement. Ligaments attach bone to bone. So there's two attachments, one for one bone, one for another, that the ligament is attaching and protecting. So you may have learned a lot of those when you did articulations, but now you have to know the bones a little bit better. So we'll go through them. And you learned endochondral ossification. You know what a long bone is. You know what a short bone is. That's really not as important now because now you have to identify the bones. The cranial bones are very difficult, but we'll go through those. So this PowerPoint, again, has a lot of information you could read through just to get you involved, but I'm going to go through it with you. Okay, and we'll go right to the main photos and what you need to look at and go through your list. So the first thing you look at when you go, again, you go into MH Connect, you want to look at the anterior view of, say, the skull or the frontal view of the whole skeleton, right? They call it the appendicular skeleton and axial skeleton, but they call it the articulated skeleton, and if it has everything on it. And you can start there in MH Connect, and I'll show you later. But this is the anterior skull view. And two main areas, you have the cranium, which is all above here. And this bone down here is called the mandible, and that's your jaw. I guess we could start with that. This is the mandible. And the jaw, if we were in the lab, you'll see that they're two separate bones, the mandible and the cranium or the skull. But still, the mandible is considered part of the skull because it articulates with the temporal bone, if you remember from articulations, and we'll see that. So what could we see besides the mandible on the anterior view? So you'll see like an X, or in an MH Connect, it's all highlighted and colored, but this whole area is called the frontal bone. That makes sense. And keep your mind on this because later on, you're going to see that the frontal bone protects the frontal lobe of the cerebrum of the brain. So it's going to make sense later. So get these down now. Frontal bone, and it's one large bone in the adult. And you might see some fetal skulls later on. I have other supplements in this learning module that you could look at and practice with. But again, this is online, so you're going to have to stick with MH Connect as much as you can. Now you can see a piece of a side bone or lateral bone. Remember, now we're going lateral and posterior. And this is the parietal bone. Now I'm looking lateral. With the parietal bone, you'll see when you see a superior view is posterior to the frontal bone. And this is a bit of a parietal right here, just an example of it. Now, the lateral skull bone is called temporal bone. And you can see that there, temporal bone. So far, what do we have? We have the mandible, and it's colored for you in blue. You have the frontal bone, all of this, in this peachy color. The parietal bone, which I probably wouldn't use this picture to show you the parietal bone. Temporal, yes. Temporal, yes. There's the temporal bone. And then later on, we're going to get a close-up of what's in the orbits, because there are internal cranial bones as well. So here we have one piece of bone above the teeth, above the mouth, I should say, and that's called the maxilla. And above that is the zygomatic bone. So let's go through it again. The mandible, the jawbone, the frontal bone, cranial bone, parietal, blue, temporal, zygomatic in green, cheekbone, and then the maxilla right here. Okay, so I'm going to go into the orbit a little bit later. I just want to get the general bones. Now, this is looking at the top of the skull, and this is called the superior view. So we're looking at the specimen's superior skull. Now, here's a little trick, and this is very difficult in lab or in pictures. So please listen to what I'm saying right now. This is anterior, right, part of the skull, and this is posterior. We're still looking at the superior view, but I'm showing you this is anterior and this is posterior. So your eyes would be below this bone, right? Of course, I'm drawing that there. So the frontal bone and the anterior portion of the skull tapers a little bit narrow. And the brain is that way too. So sometimes you don't see it. Like if this wasn't colored, it'd be hard to see. So the frontal bone tapers more towards the medial portion, where the back of the skull is a wider angle. And the posterior bone is called occipital bone. And occipital, you got to think vision, right? So you'll see later that the occipital lobe of the cerebrum associates our visual input from our retinas. So occipital bone is one bone in the back. So this is very important. Again, the frontal bone tapers to the top or to the anterior. So here's the frontal bone, colored, right? Then you have the parietal bones, and there's two of them, right and left in the adult. And then occipital bone. Now this one, you can't really see the temporal bone, but it shows you a piece of it because the temporal bone is lateral. And the zygomatic bone is the cheekbone, which forms like an arch. If you see that later, we'll show you later on. See it in the MH Connect dissection. So if you notice, you have what looks like stitching, which you probably learned in the synchondrosis, these in those joints as they develop into adult or immovable joints, of course, called sutures. So here's a suture you should know right away, because it looks like a crown when you're looking at somebody from the front, or a skull from the front, is called this coronal suture. Excuse me. So the coronal suture basically separates and is the boundary between the frontal lobe, the frontal bone, and the two parietal bones. Important. That's something we will definitely need to know. And then in the middle, dead center between the two parietal bones, is a suture called sagittal. And that makes sense. Sagittal suture. Like, Sagittarius, the guy with the arrow splits you right in half, right? It's dead center, the mid-sagittal. But you just have to call this the sagittal suture. Notice the two T's when you're spelling it on the practical exam. So that's two sutures, really important. Well, I think there's 4 we have to know total. And then in the back, you have a suture between the two parietal bones and the occipital bone. And again, you should know what a suture is from your chapter 9, I think it is, in articulations. Now, this one is called the lambdoid suture. Lambdoid. So get the spelling again for the practical. And everyone did a pretty good job on the last practical in spelling. Even some of them were off, but very close. I was pretty happy about it. Okay, so this is the superior view of the skull, which again is important. Now we have the posterior view, and we're looking at the back of the skull, basically the opposite of anterior. So now there's no spinal column here, so you could see the mandible from the back. You really can't see the whole mandible from the back, obviously. You can see part of it in an articulated skeleton. So here we go. And here's a thing I just want to point out from the back, and also you can see this from the front. Right here, you have a piece of the the temporal bone. It's colored for you in this PowerPoint, so it's helpful. And you can highlight it in Image Connect. So this is really part of the temporal bone, this yellow. And you can actually go to the back of your head and feel this process called the mastoid process. It's an attachment for muscles like the SCM. I remember the sternocleidomastoid, if you may have talked about that before. But we're going to talk about that, of course, in muscle. But it's a pretty large muscle, and its attachment is on the bone marking of a temporal bone called the mastoid process. So technically, if you see this highlighted, you would call this the mastoid process of the temporal bone, and the side too, right? Like this would be the right, because remember, he or she owns the anatomy. This is their left, and this is their right, because this is the posterior view. Okay, so let's see what we know. You have the occipital bone is the posterior cranial bone, and that separates the parietal bones, or I'm sorry, the suture that separates the parietal bone from the occipital bone is lambdoid. And then here's two pieces of the parietal bones. So this is the right parietal bone, this is the left. And the two parietal bones are separated by the sagittal suture, not mid-sagittal suture, but by the sagittal suture. So that's a posterior view of the skull. And again, we'll go through a lot of these parts, and I'll go through the list because again, we have to get to visualizing. There's a lot to see here, and you have to put all this together. I know it's not easy when you're not lifting up a skull in your hand like we would on the bench of a lab in person, but we're doing it remotely. So let's do what we can, and it's a good outcome. So if you ever do get to see a skull, you'll be amazed how much you do know from this. Okay, so this is a lateral view. This happens to be a right lateral view, if you could think about that, like you can see the orbits. We're looking at the right side lateral view of the skull and mandible, which is part of the skull. So here we have a great view of the temporal bone. And the temporal bone has a lot of parts to it, right? It goes all the way to the midline of this arch and ends at the zygomatic bone. So the green is the zygomatic bone, and all this yellow is the temporal bone. And this is paired. This is on both sides. Like so far, the only non-paired bones I think we looked at was the frontal bone, the occipital bone, maxilla, and mandible. Everything else is paired, like parietal bone, temporal bone, and zygomatic is paired as well. So the temporal bone has two parts, a flattened part called the squamous part, and a very thick walled area called the petrous portion of the temporal bone. And over here we have the zygomatic, which is green. And here's a few parts that are really important. Like I mentioned before, the mastoid process of the temporal bone. And just now, listen to the directional terms, just anterior and slightly medial is another process called the styloid process of the temporal bone. And that's on both sides. All right, so you have two main parts off of that petrous portion. You have the mastoid process and the styloid process of temporal bone. Then there's a hole that's external. And here's a term called meatus. You're going to hear that a couple of times. The smaller holes are called foramen. And sometimes some long, thick holes are called canals. But this one is pretty large. And this one has to be called meatus. It's got to be called meatus. It's a hole. So this is the external ear, where the vibrations of sound come into the ear and then go towards your eardrum, which separates the outer ear from the middle ear. So this is really important, the external acoustic meatus. Note the occipital bone, piece of that there, and there's your lambdoid suture. Here's your right parietal bone. It's the right side, remember, parietal bone. Here's your frontal bone. And this, you can see, this is the coronal suture. And this, now you really get a good look at the squamosal or squamous suture. Now there's one bone I didn't mention on the anterior because it's really hard to see. So right here, you have this piece of bone that really is inside of your skull, which we'll see on the different views. And this is called the sphenoid bone. And it has two wings. You'll see later there's a greater wing and a lesser wing. The lesser wing is more medial. That's very good. There's a word, medial. And the greater wing is more lateral. So basically on both sides, you see two parts of the sphenoid bone, right and left. And we'll review that later as well. We can start looking into the orbit a little bit on this picture. You have right here on top of the nose. I should have done this when we did the anterior view, but you know, when you put your glasses, you have that little piece of your glasses that sits on your nose. There's two pieces, two nasal bones actually, that are right there. Let me just go back and show you that. Or the nasal bone would be like this right here is the nasal bones, right and left. So that's the most medial. And that's really the term. It's medial, right? They're the most medial bones within the socket, if you should go going towards the socket. So the temporal bone is out here, right? Way out there. So it's the temporal side, and this is the zygomatic, this is frontal. And then next in, right here, this yellow part is actually all maxilla. So this is the maxilla. And then the green bone right here is called lacrimal bone. Lacrimal has to do with a gland that produces tears for tearing, like crying. Lacrimal, lacrimate means to tear. So there's a duct right up top of that, and then there's a hole where the tears will drain into, called the lacrimal duct, that will go into the nasal cavity, actually. And just inside that, you have a very inner bone, which you really can't see much from the outside unless you're looking into the socket, called the ethmoid bone. So ethmoid bone and sphenoid bone, they both take up a lot of the inside of the skull. But again, you could see the ethmoid bone through the socket. You're going to see it on the, once again, on the anterior when we look at the frontal skull. And definitely when we look on the inside of the skull. So let me go back to the first picture. And there's a couple of parts here you should know as well. So here's the frontal bone, left and right. Then right below that, now this is really important. This area is your nasal cavity. And there's a septum that separates the right and left. Like a septum is a tissue that separates two compartments. In this case, it's two sides of the nasal cavity. So the top part of the nasal septum, which is right here, is called the perpendicular plate of the ethmoid bone. The bottom part down here is a single bone called the vomer. A vomer means plow. So it kind of looks like a plow when you look at the inside of the skull where the vomer is. So remember, the vomer is the inferior septum, nasal septum, and the perpendicular plate of the ethmoid bone is the superior portion of the nasal septum. And now we can look into the orbit again on this picture, and you could see this is all zygomatic bone. This is all maxilla by its color. Here's lacrimal. There's some ethmoid in there, which you really can't see greatly here. And then you have the sphenoid. This is the sphenoid, greater wing of sphenoid, greater wing of sphenoid, lesser wing of sphenoid. And we'll get to the holes, the foramen, later on. And you can see they kind of have specific names, and we'll go through that. So let's just get the main bones of the skull. The skull takes up a lot of time. Later on, we'll do the vertebrae, which also takes a bit of time. So let's just go see what we need to know, and then we'll get to it. Okay, now this is very difficult, of course, because there's so many things going on. So this is the inferior view of the skull. We're looking up at the bottom of the skull. So now we really get a good picture of the occipital bone, all that purple. So one thing you should notice right away is this big hole. And this is where the spinal cord exits from the brain. So right below the brainstem, this is where the spinal cord will exit, go downward into the vertebral column in the center, in the vertebral canal of the vertebral column, which we'll see later. So another name for big hole is foramen magnum. Foramen means hole, and magnum is big. So it's a big hole, or foramen magnum. So we'll go through the holes or the foramen later, because there's a few that we need to know, and I want you to get the parts set before we move on to that. So let's look. You can see the teeth. Don't do a lot of teeth, but I'll show you later the alveolar margins of the maxilla and mandible. Remember, the mandible is the bottom, including the teeth, and maxilla is the top of the oral cavity, including the teeth. So this is the top of the oral cavity. So this is the palatine process of the maxilla, like your roof of your mouth towards the anterior is called the palatine process of maxilla. So this is maxilla, like it's yellow, you see. And then the back posterior part of the palate is called the palatine bone. Sorry, palatine bone. And you see holes, like foramina is plural for foramen. So there's two foramen that house nerves, like nerve tissue. Like if you ever went to a dentist and they have to put an anesthetic, they'll probably put a needle right into this area just to numb your teeth if they have to do a root canal on the top of your mouth, right? Like over here, these are your incisors. So this is called the incisive foramen. It's a hole right there for nerve, and you'll learn the cranial nerves and branches later on in the semester. Here's the vomer. This is a tough position to see it. This is the bottom of the skull, right? We're not looking up into the skull. We're looking at the bottom of the skull. So we have some foramen. Let's talk about the foramen here. We'll start now. And I think this is where you start, right down in the foramen magnum. And there's foramen, I'm not sure if this is on our list. There's the hypoglossal canals, which is for the cranial nerve 12, just adjacent to the foramen magnum. But you'll see here something called the jugular foramen. And you'll see this in multiple views. The jugular foramen now is kind of oblong, right? It's kind of oblong because a jugular is a vein, a jugular vein, and that usually has wider lumens. It's not so round. And on the bottom, you could see another canal. Now, this is a little thicker foramen. They call it canal. It's called the carotid canal. The carotid is an artery, so that is a little more circular. So again, when you're looking at the skull, again, you're at disadvantage. You're looking at pictures, but when you're looking at the skull, the carotid canal, and they're on both sides, mind you, they're on both sides. They're all paired, except for the foramen magnum. The jugular foramen is more oblong and wide, and the carotid canal is more circular and narrow, because that's the way the lumens of those vessels are. Now, there's some foramen up here. Again, you have to know the parts. And here's the mastoid process. Let me just show you a couple of things. Mastoid process of the temporal bone. Now, these parts right here, I don't know if they're labeled. Yeah, they are. These are like little slippers that kind of fit into the first vertebrae, which is C1 or atlas. And they're called occipital condyles. So they're articular processes, but these are called occipital condyles. So that's a really important part there. And as you go up, there's a bunch of foramen. Foramen lacerum. Lacerum means like torn. So it has like a torn appearance right around this part right here. So foramen lacerum. Then you have an oval shaped foramen on both sides, and that's called your foramen ovale. Then you have a spiny one called this foramen spinosum. Okay, so those are on both sides, and they're really tough to see, but again, you need to practice. So foramen ovale, that's probably the easiest one up here because it does have an oval shape. Spinosum is very spiny and small. foramen lacerum is lacerated, kind of like looks torn, so it looks kind of jagged in edges. Then you have the jugular foramen and carotid canal, and the foramen magnum. And there's a foramen called the mastoid foramen. I don't think that's on our list. There's a stylomastoid foramen too, as well, between the styloid process and the mastoid process of temporal bone. Carotid canal is only seen on this view, the inferior view. You won't see it later on in the superior view, inside the skull, that is. Jugular foramen you'll see on both. There's another foramen you don't see on this view, and it's called the foramen rotundum, which you'll see on the superior view of the skull. So a lot of things in the skull. So we have to get to this picture. And this is the internal view from the superior. Now here's where you don't see the carotid canal anymore, but what do you see is the foramen magnum right here. So now we're looking as if we cut your head in half from the top, looking down into your skull. So the brain is sitting in here. So we're looking at a superior view of the internal skull. And this is the frontal bone here. Remember the tapering. And we'll talk about sinuses later. And here's the posterior, which is the occipital bone. So we're looking like into a nut bowl, like we use the skull as a bowl for nuts. This would be what it would look like. And you'd see the anterior middle, and then you have your posterior fossas where the brain sits. And really, there's so many parts you have to know here. That's really not that important right now. So here's a couple, let's get right to it. Here's some, and always remember like the cute names, like the things that are different, because those have a chance of showing up, and they're always important. Like right here, you have this little complex that really sits right above your nasal cavity, and it's all part of the ethmoid bone. So in the middle, you have a bump called the crista galli. And then on both sides of the crista galli, you have these structures called the cribriform plate. And there's foramina in there, which are little holes for olfactory sensory nerves. So that's about smell. So the olfactory bulbs basically sit in the cribriform plates separated by the crista galli. So both of those are separated. So there's two olfactory bulbs, which you'll see in the brain, just below the frontal lobe. And this is where it sits. And that's for about olfaction, is the sense of smell. So this two parts of the ethmoid bone are important, the crista galli and the cribriform plate. And here the blue is a sphenoid. It looks sphenoid bone, and it looks like a butterfly. And this is really important. In the lesser wing of sphenoid, you have two canals, and this is for the optic nerve. So we call these canals the optic canals, and it's on both sides. So this is a great view for that. And you could also see it in the anterior view and the socket view of the eye socket, the orbit. So this is really the lesser wing of sphenoid here, and this is greater wing, and it's in blue. And here's the temporal bone. Now, this is an important structure I want to get to right away. You remember the external acoustic meatus. Now, on the internal view, superior, you have the internal acoustic meatus on both sides. So that's definitely a really important thing. I'll definitely will ask you the difference between the external acoustic meatus and the internal. And here's the other part, or the inside of the jugular foramen. We met those already. And you have the hypoglossal canal, which is just adjacent to the foramen magnum. This is all occipital bone. It's pieces of the parietal bone. Get your point of view, get your directional terms. Anterior, posterior. This is an internal view, but it really is a superior look. You're looking downward into the skull. So that's really important. So you'll go through your list, you'll see your pieces of sphenoid, temporal, all of those, parietal, occipital bones. Now we have some more foramen to notice. Right over here, you can see that oval foramen ovale. Then you have that lacerated foramen lacerum, and you have that small foramen spinosum. Sorry about the dog. I have no control over that. So give me 1 second. Sorry about that delay. I just want to keep the dog quiet as possible. So we have the jugular foramen. You can see, you can't see the carotid canal, but you do see what's called the foramen rotundum. And it's round. It's round. So again, we will practice this in MH Connect. Just want to get you the names, get you visualized, get you started, because you have a lot of work to do on your own during the week to memorize, not memorize, but visualize and use pictures and use the MH Connect or atlases or coloring books, whatever helps you. Okay, so you have a lot of those foramen avals, spinosum, placerum, and now you can see rotundum. Couldn't see that from the interior, the inferior view. Okay, so let's just maybe take a little break. Any questions?